Hi, welcome to Case of the Day, and here we are on Tuesday, and we have case 26, Ligamentum Teres injury and Pulvinar Effusion-Synovitis. So this 45-year-old lady presented with pain in the left hip and the inability to fold her leg and sit for 1 month. Now, typically when we do a hip MR, and there are different protocols, but the first sequence we do is a stir coronal. I remember 20 years ago I gave a lecture on why the stir coronal is the single most important sequence, because it tells you there and then whether there's any gross pathology or not. So in one sequence you can make out whether there's AVN, major FAI dysplasia, arthropathy, insufficiency, stress fractures, etc. Then when you don't find anything, you look for subtler signs of instability, FAI, etc. But when nothing is obvious, it's a good idea to look at the foveal ligament or the ligamentum teres, and you can see that here, that this ligamentum teres on the left is abnormal. It shows thickening and altered signal compared to the right. So what is the ligamentum teres? And I've taken this verbatim from this radiographics article that came out, I think, late last year. So it's a ligament that arises from the transverse acetabular ligament along the inferior margin and attaches to the periosteum of the fovea. So it's very easy to see that's your transverse acetabular ligament. This is the band that arises and then attaches to the fovea. And you can trace it on multiple axial images, but you can see the dark foveal or ligamentum teres ligament here. Sorry. Um, so you can see in our patient, the right side is normal and the left clearly is abnormal with altered signal and thickening. And when we look at the PD fat sat, that's your double oblique axial, and these are your coronals. The right side is normal. The left, you can see the superior part where the foveal attachment is abnormal, whereas the inferior part at the transverse acetabular attachment is normal. So clearly there's a partial tear with evidence of injury. Now, you could argue that the right side is also showing altered signal, but it's dark and normal on the stir and T2, so I wouldn't worry about that. It's probably magic angle artifact, and we see this quite often. So to be sure that this is abnormal, we need to get the appearance that we're seeing on the left, which suggests a partial tear. But there's another sign that helps, which I wasn't aware of until I read this paper from European Radiology, and I'll come to that. So, what is the sign? That's the normal pulvinar fat on the right. On the left, it's effaced, it's smaller, there's effusion here, and on the stir, you can see that there's increased signal. And this is effusion synovitis on the left as compared to the right. Secondary to the ligamentum teres partial tear and injury. That's the paper which describes this in detail, and you can see that even on the PD fat sat where the pulvinar fat is suppressed here, but there's no suppressed fat here. All you're seeing is abnormal increased signal, which is the effusion synovitis along with the ligamentum teres injury. Now, more and more, we're seeing ligamentum teres injuries. We're able to identify these as a cause of pain, instability, and eventually they may cause accelerated hip degeneration and OA. And it may be the only finding, as in our patient here, or it may be part of other capsular labral pathologies. Now, in the past, arthrography was the mainstay, and we've done a few arthrograms in the 2000s to look for cartilage lesions, and we used to look at the ligamentum teres at that time. But now with the improved resolution of the 3T scanners and the high-end 1.5T scanners, you can see the ligamentum teres quite well, and you should be able to pick up pathology. So the way it works for me is, when I don't see an obvious cause for hip pain, I will then spend 10-15 seconds looking at the ligamentum teres to identify partial tears. And now I've learned to look at the pulvinar fat as well. to see if there's edema compared to the normal side, and that kind of corroborates or reiterates the fact that what we're seeing in the ligamentum teres is clearly abnormal. That's my WhatsApp channel, and thank you for viewing this. Take care.